Hello, and welcome to How to Have a Good Future with Kidney Disease, Part 5. Today, we'll talk about dialysis and your lifestyle. Hi, I'm Mary Beth Callahan. I'm a kidney social worker, which is sometimes known in the dialysis world as nephrology social worker. Currently, I work at Dallas Transplant Institute, but I started out working with kidney patients and families 32 years ago, working with hemodialysis and peritoneal dialysis patients. So it's really nice to be with you today. Thank you for tuning in. Life is a journey, isn't it? And life with kidney failure is a journey. You can go to different places on a journey and get there in different ways. And we're going to talk today about what your journey might look like with dialysis. We're going to cover that there are several types of dialysis. So you may already know this, and you may not know this. But as we review this, keep in mind that each type of dialysis may have a different impact on your lifestyle. And I'd like for you to think about grabbing a pencil and paper to take a few notes along your journey today, and think about, as we review the slides, how each type of dialysis might impact your personal journey. When thinking about dialysis, it's good to step back and think about what's the most important thing in your life. And this differs for everyone. There's no cookie-cutter answer for anything across the board. For some, it's important to be available to take care of children or a loved one. For some, being able to have very few diet limits is the most important. For some, it's being able to travel. Dialysis can affect many parts of your lifestyle. So remember to try and choose the one that fits the way you want to live. Find out as much information as you can ahead of time. All dialysis is done through a clinic, even home treatments, and we'll talk more about that. One thing to keep in mind is that the choice you make doesn't need to be a permanent choice. In fact, if you think about the types of treatment that you'll have over your lifetime with kidney disease, your treatments will probably change during the course of your lifetime. If you try a treatment and it doesn't work out for you, or you learn more after you get started, you can change. And just as an aside, for medical reasons, some treatments may be a better fit for you than other treatments. And so you'll want to talk that out and be sure you understand why the doctor is telling you what they're telling you about medical reasons. Ask all the questions that you need to get the answers that you feel good about to make decisions. But please do try and give your treatment a good try first before changing. You know, you might be dealing with a lot of things that might play into your thoughts about treatment in the early days of dialysis treatment. Sometimes it's hard to sort everything out. Your dialysis social worker can help you with this. Before we learn how dialysis works, let's look at your life. Let's think about what's important to you. Some things that people talk about to me and that you might want to think about are being able to eat and drink what you want. For some people, it's not taking, which means not paying, for a lot of medications. Some people want more control of their time, and that may be for a lot of reasons. Many people want to or need to remain working, and that may be one of the big reasons why they want to control their time. Some people want to travel. Different treatments make that more possible. Your sex life or the ability to have children may be the most important thing in your life during a certain period of life. There may be other things that, as we've talked about this, something jumped out in your mind and thought, well, you know, this is important to me. Keep that and other priorities that we talk about in mind as we go through the next few slides. You may want to write them down as your thoughts go by. For me, I don't always remember things at the end of a presentation as I do as I'm going through the presentation. So now we're going to talk a little bit about kidneys briefly. The job of healthy kidneys is to keep your body in balance. So when we think about a treatment, the closer a treatment gets to keeping you in balance, the better you're going to feel. When you feel better, you can do more in almost every area of your life probably. Remember that the kidneys that we're born with usually work 24 hours a day if we're born with healthy kidneys. We're going to look at 6 lifestyle factors. For each one, we'll talk about transplant and the different types of dialysis. Watch the colors in the tables that will be coming up. We'll use green when an option does an excellent job with that lifestyle factor. We'll use yellow when an option does a good job. And we'll use red when an option is not as good for that lifestyle factor. It's kind of hard to understand this right now, but don't worry about that. We'll just kind of go through it and you'll see what we're talking about. Just make a note of what would fit best in your life. Let's start first with which treatments might give you the most food choices. So if being able to eat and drink more freely is the most important thing for a person, looking at this might be one of the most important things to consider. You have the most food choices and the fewest food and fluid limits with transplant, home hemodialysis, which can be short daily treatments and or nocturnal treatments, and in-center nocturnal hemodialysis. Most people on peritoneal dialysis have few diet and fluid limits. Many need more protein. Standard in-center hemodialysis requires the most limits. It is the least amount of treatment. Remember that balance that we were talking about. If you have some kidney function left, it can help ease the limits on diet and fluids with any treatment. Very often when a person starts dialysis treatment, there may be some kidney function left, and often this decreases over time. On standard in-center hemodialysis, you would need to limit fluids to about 1 quart a day plus any urine output that you make, and that may be a little bit harder to measure. You also need to limit salty foods like French fries, potato chips, high potassium foods like fruit, high phosphorus foods like beans, nuts, and dairy. Now, if you have diabetes, you will still need to limit carbohydrates and count those. So if you choose this option, you must follow the strict limits to feel your best. There is a dietitian at every dialysis center that you can work with to help you understand this more. Other treatments, other than standard in-center hemodialysis, remove more wastes, so the diet of these other treatments have fewer limits. Other treatments also remove more water, so with the other treatments, you can also drink more. How many medications will you need to take and pay for? This is always an important question when we're thinking about living in our lifestyle, I think. You have the most medications with transplant and standard in-center hemodialysis, which we consider 3 times a week. People on peritoneal dialysis take fewer medications, and you would need the fewest medications with home hemodialysis, both types, nocturnal and also with nocturnal in-center hemodialysis. Um, so even though we might think of transplant as being a good treatment choice, you have to remember that there are a lot of medications to take. And for some people, that's a very difficult thing to do. And so thinking about lifestyle factors is, again, very important. But when you think about making the choice between in-center hemodialysis and some of the other choices, if taking a lot of pills and paying for a lot of medication is important, considering some of the other dialysis options may be a good thing to think about. Now, what about taking a little bit more control of your time? All home treatments give you more control of your time. With a transplant, you'll mainly have doctor visits. There will not be generally any dialysis treatments. Sometimes after the transplant, a kidney is slow to wake up, they call it, and there may be some initial dialysis before the kidney kicks in. But after that, if the kidney is working, there's no dialysis treatments. There'll be doctor treatments and perhaps infusions. But home treatments can be done on your schedule with a monthly clinic visit. So this gives you a lot of control of your time. In-center nocturnal dialysis, where you go to get hemodialysis at night, keeps your days free, which is very helpful, it seems, to people who want to remain on their work schedule during the day. With standard in-center hemodialysis, ask and ask and ask for a schedule that fits your lifestyle. And also remember, depending on where you live, that there may be another clinic available in your same area with a different schedule. But keep asking and try to help the clinic management understand why it's important to have a change in your schedule. The clinic will help you if they have an open slot. So again, keep your pencil out. We're still going with these ideas about your lifestyle. Which treatment makes it easier to keep your job? If working is important to you, all of the options except standard in-center hemodialysis are work-friendly. That means they are not done during the work day. You may have fewer symptoms that might make you miss work. You may have fewer days in the hospital. Your thinking may be more clear, and you may have more energy for work. Now, some people do work and do standard in-center hemodialysis. There are evening shifts that in our area in Dallas start in various places somewhere between 4 and 5:30 generally is the latest standard in-center hemodialysis shift. And this is sometimes still difficult for people who want to have a regular work schedule, but in larger cities, it's certainly something to look for and to at least ask what the last shift of the day is for in-center hemodialysis. However, all of the other treatment types will be more work-friendly than in-center hemodialysis 3 days a week, so something to consider again. What about traveling on our journey? Travel is easiest with a transplant because you take your treatment with you wherever you go. You take your medicine with you. With peritoneal dialysis and home hemodialysis, you can bring your treatment along too. The PD cycler or the next stage machine can go in a car, on a cruise, or on an airplane. The company that supplies the supplies will ship you the supplies in anywhere in the continental U.S., and it's free. On in-center hemodialysis, people can and do travel, but it's a challenge. You have to plan this months ahead of time, and it's really best if you try to make this plan yourself. The dialysis clinic may help you find a slot and will send your lab test, but the travel clinic may run out of space at the last minute. And so the other thing that can happen is that the travel clinic location or time slot may be convenient. So again, it's harder to travel with in-center hemodialysis and much more flexible with the other types of treatment. So which treatments might be best for my sex life? Remember that balance, that more treatment means cleaner blood. That can help your sex life and your chance of having children. Many men and women on standard in-center hemodialysis have problems with sex. Men have erectile dysfunction very often, and women may have trouble with arousal, lubrication, and reaching orgasm. It's very common that both may lose interest in sex due to hormone changes. And there are body image issues, such as the dialysis access and hair loss, that can affect a person's self-image and make having sex more uncomfortable. And going through these processes, anxiety and depression can become an issue, and we know that that can have an effect on sex. Counseling and medications can help, but if this is really important to you, you may want to consider a different treatment choice. Pregnancy on dialysis is high risk, but it may be possible. So if you are of childbearing age, it's important, very important, to use birth control if you don't want children. Women who lose their periods during the phases leading up to dialysis or chronic kidney disease or even after starting dialysis may get them back after starting treatment and becoming a little healthier. So again, it's important to discuss this with your doctor, even if they don't bring it up, if you're of childbearing age, to use birth control if you don't want children. Now, if a person becomes pregnant while on dialysis, much more dialysis is needed during pregnancy, and the risk of the baby being premature is still very high. So before pursuing pregnancy while on dialysis, if you're going to purposely become pregnant, it is certainly something that you want to discuss with your kidney doctor or nephrologist. Now, pregnancy may be more possible after transplant, and many people with kidney failure also choose to adopt children. None of these are easy decisions, but thinking about these things at a time as you're making decisions about your treatment options is important to consider. You know, statistics apply to groups and not necessarily to individuals, but I think statistics help us to make decisions. It makes sense that more dialysis feels more like having working kidneys and can help you live longer. I'm sure that makes sense to all of you listening. Peritoneal dialysis survival is better than standard in-center hemodialysis for the first 3 years, or while there is still left over, or what we might call residual, kidney function. Then studies have found that people who do short daily hemodialysis or nocturnal hemodialysis in a center or at home tend to live longer than those who do standard hemodialysis. Now, nocturnal home hemodialysis has about the same rate of survival as a deceased donor transplant. And I think it's very hard sometimes for people to really grasp that idea as I talk to them about treatment options. But I think that this is a very important thing to remember, so I just want to say it again. Nocturnal home hemodialysis, the last option there in green, has an 85% chance of a 5-year survival, which is the same as that for a deceased donor transplant. So it may be something that you have to seek out information several times to find a little bit more information on. We'll have a slide at the end of this webinar that will lead you to information about it, but it's certainly something to consider, I think. And now we're going to talk a little bit more about the specific types of treatment. Now that you've thought about what might fit your lifestyle, let's look at peritoneal dialysis, or PD. PD uses your peritoneum as a filter for your blood. Your peritoneum is the inside lining of your abdomen. A PD catheter is placed in your body, or occasionally it could be in your chest as a presternal catheter, but usually in your belly. You learn to use this tube to fill your body with sterile fluid. And waste and water in your blood flow into the fluid. However, during this process, blood is not flowing. And I think that's an important distinction, that when I'm talking to patients about treatment options, it's not always clear that with peritoneal dialysis, unlike hemodialysis, which we're going to talk about, there really is not the exchange of blood. So again, you learn to use this tube to fill your body with sterile fluid, and the waste and the water in the blood flow into the fluid. Then you drain out the used fluid and put in fresh fluid. Now, peritoneal dialysis can be done 4 times a day by hand, but most people prefer to use a cycler machine at night while they sleep. This way, their days are free. For some people who are larger, sometimes if you're using a cycler, a 5th exchange during the day may still be needed. Remember the importance of keeping balance in your body. And the more treatment, the better that a person usually feels. Dialysis removes water and wastes from your blood. Peritoneal dialysis works every day. So it's in some ways more like the kidneys we were born with. It's a continuous treatment that keeps you in balance. There are no ups and downs in how you might feel from one day to the next on PD. Peritoneal dialysis is very gentle, but it can be less efficient than hemodialysis. So it works best when someone still makes some urine. One of the things that I'm often asked about again is about the blood in PD. And the waste and the water are being taken out in a gentle way by gravity rather than filtered through fine hair-like structures in the hemodialysis dialyzer, which we'll talk about. So one of the important things about peritoneal dialysis is the gentleness and the balance that it provides, which is very similar to our own kidneys. And again, it works best if there's some residual kidney function. Now, again, we said that most people use a cycler at night to do the exchanges, but when people are being taught, they're usually taught to do the peritoneal dialysis exchanges manually or by hand. The training only takes about 2 weeks or less sometimes to learn how to do peritoneal dialysis. A nurse will visit your home to help you get ready. and you will learn to follow the steps exactly how they need to be done. They will teach you the steps just as you need to do to avoid infection. And they will allow you to do it with them until you feel very confident. You won't be allowed to go home and do it on your own until they are confident that you can succeed. The other thing that I think is important and comforting to people is that there is going to be a nurse on call 24/7 to answer questions for you if something comes up while you're doing peritoneal dialysis or you're draining the fluid out. So I think that's a way to help us think about decreasing anxiety, to know that there's a nurse on call 24/7. So PD fluid has sugar in it, so you may need to limit some of the carbohydrates to avoid weight gain. And if you have diabetes, you may be able to add regular insulin to the PD bags. So there are lots of things that you can learn about peritoneal dialysis. And again, this gives you a great deal of control. Now, you don't need a big house to do peritoneal dialysis. People who live in small apartments or mobile homes have done peritoneal dialysis, but you do need space to store about 15 boxes, as you see the size in the picture. And you want to ask whomever's looking at your house, and they will be able to assess this also, about safe storage temperatures for peritoneal supplies. It's okay if they freeze and then thaw, but it's not okay for them to get too hot. And I think about heat a lot here in Dallas, Texas, where I live. But we have a lot of people here in the Dallas area that do peritoneal dialysis. The supply company will bring the boxes once or twice a month to your home, and they will unload the boxes and put them where you want them, even upstairs. So we talked about medical reasons and how they relate to choices. While most people can do peritoneal dialysis, even those who've had a C-section, hernia repair, or a transplant, that should not stop you from going forward with peritoneal dialysis. Sometimes if a person has had multiple or complex abdominal surgeries, peritoneal dialysis might not work. With peritoneal dialysis, one of the advantages is that you don't need a partner. If you like to take baths instead of showers, peritoneal dialysis may not be a good fit for you. Swimming may be allowed in private chlorinated pools or the ocean. Swimming in lakes, rivers, or public pools, though, could cause an infection. Hot tubs can also cause an infection. You can cover up your PD catheter with a waterproof dressing or ostomy bag and then care for it when you're done in the water. So all these things are things that, no pun intended, you might want to flesh out with your doctor as you talk about treatment options. Now we'll talk about hemodialysis, or HD. It's the other main type of treatment. Your blood goes through a dialyzer, and the dialyzer has filters inside of it to clean your blood. And a blood pump pushes your blood through the tubing. And so during dialysis, the blood is always moving through the blood pump and this filter. And sometimes people have asked me how much blood is outside of their body during the time this is taking place. And it's my understanding that it's about a half to two-thirds of a cup of blood out of your body at any one time. It looks like more than that, but I think it seems to help people when we talk about the amount that's really out. Most Americans currently with kidney failure do standard hemodialysis in a clinic 3 times a week. Each treatment lasts about 3.5 to 4 hours, but remember, more is better. If treatment is on Monday, Wednesday, Friday, there is no treatment on Tuesday, Thursday, Saturday, or Sunday. So between treatments, wastes build up. These ups and downs can be quite big, and they are particularly hard on the heart. It takes from 2 to 12 hours to feel good after a standard hemodialysis treatment. That's why sometimes people prefer to work during the day, do dialysis in the evening, and then go to sleep and wake up ready to work the next day if they're trying to remain working. Most sudden death on dialysis happens after 2 no treatment days. Sometimes it's hard to imagine how important dialysis is, but we have to remember that dialysis is doing the work that our kidneys do 24 hours a day. So missing 2 dialysis treatments would be missing a lot of work that our normal kidneys would do. Because there is no treatment 4 days a week with in-center hemodialysis, you would normally need to take many medications and be required to limit your diets and fluids. So you must limit what you take in because there is less time to remove it with standard in-center hemodialysis. If you go to a clinic for hemodialysis, they may have 2 choices. One choice is 3 days a week, as we said, for about 3.5 to 4 hours, and this is standard hemodialysis. The other choice is 3 nights a week for about 8 hours. So this would be twice as much hemodialysis, and this would mean fewer medications and fewer limits on your food and drink. The treatments at night leave your days free, and the longer treatments are gentler and easier on your heart. Hemodialysis at home can be done more days a week or at night. It's very portable. Obviously, you can go to the beach and travel to a lot of places. In this picture, you can see a next stage machine being used by someone who is now transplanted, but he really made the most of life while he was on dialysis, and now speaks to people about home hemodialysis because it was so successful for him. The machine is about the size of a microwave oven and weighs about 70 pounds. It can go in the trunk of a car or on an airplane in a travel case. Home hemodialysis can be done as short daily 2 to 3 hour treatments 5 to 6 days a week, or home hemodialysis can be done 8 hours at night while you sleep. This is called nocturnal hemodialysis and leaves your days free. Treatments done at night are very gentle and easy on your heart, like we talked about in the last picture for in-center nocturnal dialysis 3 evenings a week. This graph shows what happens when you do hemodialysis treatments 6 days a week. As you can see, the ups and downs are small, so people tend to feel good from day to day. People feel good about 30 minutes after short daily treatments. Medicare routinely pays for 3 hemodialysis treatments a week. To do short daily, it helps to have insurance besides Medicare. If a doctor writes a letter, Medicare will usually pay for 4 treatments a week of standard hemodialysis treatments. But I just think it's dramatic to think about what the difference is in the ups and downs. Now, this graph shows nocturnal treatments 3 nights a week. The treatment, remember, is twice as long, so they remove much more waste and fluid. people feel good just 10 minutes after a nighttime treatment. And again, this makes it seemingly more doable for patients to maintain their normal work schedule. They sleep right there in the clinic doing nocturnal dialysis. There are things to think about with hemodialysis too. Your risk of infection is very high if you start treatment with a catheter. If you know you want to do hemodialysis, get a fistula or a graft and get it early enough that it has time to mature before you need to use it. Often people want to wait for as long as possible to get an access or which is a fistula or a graft, but I encourage you to get this as early as possible. One blood infection from a catheter can hurt your chance of survival for up to 5 years. If you choose in-center hemodialysis, make it work for you. Get as much treatment time as you can. Remember, more is better. Come to all treatments and stay the full time. Learn as much as you can from the staff about how things work. Be an active part of your care and follow your treatment plan to feel your best. Always ask questions. There are ways to handle the hemodialysis needles. The best accesses for hemodialysis use needles. If you missed section 2, which was kidneys and kidney disease, just real briefly, the 3 types of accesses are fistula, graft, and catheter, which we discussed in the last slide. If needles bother you, numbing creams can be put on your skin 1 to 2 hours before treatment. A freezing spray can also numb just the top of your skin very quickly. And relaxing can help a lot. And this takes some practice sometimes, but sometimes this means focusing on taking deep breaths, and this takes a little training at home sometimes, but you can do it. Putting in your own needles also allows you to be in charge. The other thing it does is it distracts you so the needles hurt much less because you're focused on something else. No one else can put in your needles as well as you can. If you want to do this, the care team at the clinic can teach you how, and I would suggest considering this. If you decide to go home, a nurse will train you to do home hemodialysis. Training takes 2 to 6 weeks, but you won't go home until you are confident. You do not have to buy the machine. The clinic will lease it for you after checking with your insurance, including Medicare. At home, a nurse is on call, again, 24/7 if you have questions. You can also call the machine company. You do need a home of some kind to do home hemodialysis, but it doesn't have to be really big. You'll have some supplies to store and organize, and most programs will require a partner for home hemodialysis. Even though a partner is required, it's best if you do most of the tasks because it's your treatment. Home hemodialysis can make strong relationships stronger, but it can be hard on weaker ones. What you need most to succeed with home hemodialysis is to believe that you can do it. It's important to know what to expect when you do dialysis at home. It's a lot like learning to drive a car. At first it's scary, and there are a lot of steps to learn, and it is life and death. But in time, driving becomes routine. Dialysis does too, believe it or not, but you have to stick with it to get there. You and your partner need to make a list of the tasks and figure out who will do what. And it's best if you do as much as you can because it's your treatment. So we've covered a lot, and you still may not be sure which treatment to choose. This is a lot of information to think about. There's a great free online tool that can help you see what might fit your lifestyle best. I encourage you to visit mydialysischoice.org to try it. If you don't use the internet, perhaps a family member or a friend can help you. I think you'll like using it. If you or your families or friends want to learn more about the dialysis choices, this book from the nonprofit Medical Education Institute can help. In fact, it's called Help, I Need Dialysis. You can also order a copy from lifeoptions.org or buy the print book or ebook on Amazon.com. And it covers all the dialysis. It's easy to read, and it's easy to flip back and find things that you want to refer back to. So it's a very easy book to use. So our takeaways today: make dialysis a part of your life, but not your whole life. Just last week, I had a new patient here at the transplant clinic who had been doing dialysis for about 13 years, and he told me that he really kept dialysis a small part of his life. He had 6 children. He kept a part-time job, and he was such a positive person and remained so healthy because he remained so active. And I encourage you to make dialysis just a part of your life. But remember that your whole life is the rest of the time. And figure out what you want your life to look like. And don't give up on your dreams just because your kidneys don't work. I hope you'll join us for the next session where we'll talk more about not giving up on your dreams. Try the treatment that feels right to you. You can switch if it doesn't work the way you think it will, but learn all you can. I really appreciate you joining us today and want to share with you some websites where you can find further information about dialysis and treatment. Kidney School is one that I refer patients to all the time, and Home Dialysis Central. I find them so easy to use, and Life Options I find so encouraging for patients. So thank you so much, and it's been a pleasure to be with you today.